Hello and welcome to Bed Making with Abbey Healthcare. My name's Felicity and I'm a clinical service manager over at Farnworth Care Home. I've been a registered nurse for the past 19 years and I'm hoping that you get a lot out of this training.
Hello, my name is James. I'm the registered manager at Farnworth Care Home. I work alongside Felicity, our clinical services manager. I have been a registered mental health nurse for about 15 years. And I love my job. So welcome to bed making.
You've got to remember that making the bed composes of many components and one of those is moving and handling, the other is infection control, and most importantly is about comfort of the bed for someone to have a good restful sleep in. So moving and handling, we're going to raise the bed so that it's at the exact level for both of us. As we're both a similar height, we'll go with mine height. We'll just raise it up, and this is just to protect the lumbar region of our backs when we're doing any bending forward. We're then going to put our PPE on. So start with your apron. We're then going to pop our gloves on.
Thank you.
Once we've got our gloves on, we're then going to make sure that the bed mattress is as clean as it can be. So again, just to prevent any infection spreading. So we're using antivirucidal and antibacterial wipes. You take one, and we're just going to wipe the mattress down from top to bottom. Once the mattress is wiped down, we dispose of our wipes in a white plastic bag, ready to go into an infection control bag once we've completed the task. Just pop that on that side for me. So then we're going to lay the sheet. So we start with a flat sheet because this is what we call a Memoflex mattress. If we were using a dynamic mattress, something to bear in mind is that we do not tuck the sheets in, because that then changes the way that the dynamic mattress works, okay? So we get our sheet and we spread it out, ensuring that it fits the full length of the mattress. There we go, just lay it down gently, and then we start at the top. So we lift the mattress to help ourselves and our backs. We're going to fold it over, make sure we've got enough at the back, then fold it again into itself, and this little corner will then go underneath, followed by this, which gives us a nice, tidy, secure corner. We then lower the mattress and go to the bottom end of the bed. We repeat this, so we pull it over, pull it in and round about so you've got a nice tidy triangle in the corner. Lay it down and then just go along tucking your sheet in, recognising that you've got a nice smooth sheet. So next we're going to put the pillows on. So we have 2 pillows. Now, as you can see, these are pillows that are reusable, so they're washable, but because of that, that means that they have sort of plasticky feel to them. If a resident was to have their face up against this, that increases the risk of rashes, pressure sores, increased sweating. So one of the things that we're going to do to reduce that happening is what we call double pillowcasing. So we take 2 pillowcases, And we put one pillowcase on first. So we've all put pillowcases on, I'm sure. Find the open end. And literally pop it in, ensuring that the corners go to each corner and it fits snugly. You're then going to get the lip and make sure it's tightly in. Okay. Now, because nobody sleeps in the same position and can wiggle the head, at risk of this coming off and the exposing the pillow underneath. So what we do is we get our second pillowcase, and with the open end, we pop that in first to the closed end of the second pillowcase. So this just gives us that extra protection and ensures there's no risk of the residents coming in contact with the actual pillow itself. Now this pillowcase is really good because it has a zip on it, but if it doesn't, we just fold it over like we did underneath. We then pop our pillows at the top, make sure they're all fluffed up. Nobody wants a soft pillow. There we go. And then we go on to the quilt. So find the bottom end of your quilt. That's usually where your tag is, so you know that's your bottom end. Get your quilt cover, and it's inside out, so that makes it easier. So I will grab the bottom end, the top end corners, sorry, and my assistant will pull those down, pull the whole sheet down, and there we go, on in one. Again, make sure it's sealed at the bottom, whether that be with buttons, zips, or folding over, however the quilt is made. So now it's about making the bed look inviting. Get your quilt, pick your pillows up. Finishing touches, add a bit of colour. That's that side. And there we go. And there is a nice, comfortable bed. The question that you have to ask yourself is, would you get into that bed? Would you sleep in the bed? And if the answer is no, then why would you expect a resident to do that? Restart again. Thank you. And to summarise, we're going to raise the bed to an appropriate height for the staff which are making the bed, bearing in mind that if someone is smaller, we're going to use their height as the guide. We're then going to add our PPE, put our aprons and gloves on, and then we're going to clean our mattress down. Then we're going to add our sheet, make sure it's tight, the corners are tucked in nicely, unless it is a dynamic mattress where we're going to leave it loose. We're then going to do our pillows, and we're going to double pillowcase them to protect the resident's skin from any overheating, skin conditions, things like that. And then we're going to cover our duvet cover, and we're going to put it all together to make it look inviting and sleep worthy.